Hello and welcome to my channel. White people call unaliving people of color as the only way of solving the race problem in America. Now in this video, the palm color man explains how they are to do that, or how they've been doing that, and the conclusion is that if simply Americans avoided allowing black people any access to healthcare, then in 2 to 3 generations the whole race will be out of the picture, and according to them that will solve the race problem in America. Here is the video.
He published a book called Race Tendencies and Traits of the American, in which he lays out all the numbers, and then he concludes that if we simply avoided allowing black people to have any access to health care, that within 2 or 3 generations, the whole race would die out, and that would solve the race problem in America. When Teddy Roosevelt, 1912, proposed a national health care system, people said no because black people will get it. When Franklin Roosevelt proposed a national health care system, it was the same thing. We don't want black people to get it. When Truman tried it in 47, same thing. Don't want black to get it. We have to figure out a way to keep black people from using Medicare. And the way that they came up with was to have a 20% hole, a gap in Medicare, so that you had to pay 20% of your doctor's bill and your hospital bill, and that would discourage poor black people from showing up at the hospitals. Nearly 100% of the reason why the United States is the only country in the world that doesn't define healthcare as a right is because of...
So which led him to his second hypothesis, which was in his book Race Traits in 1896, which was that if white people who control the politics and most of the economy of the United States simply deny health care to black people, the black race, again his phrase, die out in 2 or 3 generations. And that would, quote, solve the race problem in America. Frederick Hoffman took this theory, pitched it to Congress, gave lectures all across the United States to state legislatures, met with governors, to physicians groups. He was beloved by those establishments. By the way, he was the co-founder of the American Lung Association. I mean, the guy was no slouch. He was powerful, he was famous, and people took him seriously. Woodrow Wilson, and this is why in 1912, when Teddy Roosevelt proposed a single-payer health care system to cover everybody as part of his square deal plan when he was running for president for re-election, this was why that got shot down, because white people, including the medical establishment, white people by and large said, particularly the whites in the South, said, wait a minute, if you cover everybody with health insurance, you're going to be covering black people too, and we can't have that. So that ended that discussion in 1912. It's also why they came after Franklin Roosevelt in 1936 when he proposed a single-payer system. It's why they came after Harry Truman in 1947 when he proposed a single-payer health care system. But black people, we can't do that. Black people will get that health care. And this is why they came after John Kennedy in 1961 when he proposed a single-payer health care system. And it's why when Lyndon Johnson and Robert Ball were writing the Medicare law in 1965, the Southern racist conservative senators came to them and said, you need to build into this thing a bar high enough that poor black people in the South, and 60% of black people live in the South right now. It was even a higher proportion back then in the 1960s. So the poor black people in the South won't be able to jump over that bar and show up in our all-white hospitals. So they took Medicare Part B, which is the part that pays for hospitalization, and said, we're only going to pay for 80% of the hospitalization. There'll be a 20% gap, which is the gap that you fill in with your Medigap policy now. That gap was to prevent black people from presenting themselves in hospitals unless it was just an absolute screaming life-ending emergency. So from the beginning through the 1960s, the reason why the United States never acknowledged health care as a right rather than a privilege was because of Hoffman's theories and whiteism. I mean, they were just like intertwined. I don't know how else to say it. And that prevailed right up until the 1980s, that kind of thinking and that kind of opposition to any kind of health care program.
Now, the data shows that racial and ethnic minority groups throughout the United States experience higher rates of illness and unalivings across a wide range of health conditions compared to white people. And some of the factors that have made it difficult to provide healthcare coverage for people in America is the rise in healthcare costs, the economic downturn, and erosion of employer-based insurance, and public program cutbacks. With that said, let's now check what people had to say in these speeches.
Roosevelt proposed a national health care.
And this is why we find that the vast majority of people who are against things like universal health care, food is a human right, or free college, and to have quality K through 12 public education, it's not because they don't want those benefits for themselves, but they don't want other people to get it. Specifically, Black, minorities, the working class, the poor, and immigrants. So they are willing to suffer in the short term with the hopes that in a generation or two, that's their plan. They're just waiting us out.
20% hole, a gap in Medicare, so that.
Now listen to how diabolical this situation is, and understand that they are implementing this same mindset to the economic decay that's taking place today. So you telling me that the way that they discouraged poor people, we're just going to use the term poor so that we can be all inclusive. Don't want to make this racial, just even though we live in the most first place ever. So you impose this poor people tax so that you can discourage them from being able to receive Medicare. You give the descendants of slaves reparations, and get what? You kick that theory out the door. But now, being that you never did that, and we can look back on history and see what the effects of not having reparations and what all of the systemic issues and economic inequalities has created, right? And now you're dealing with an economic issue that the majority of working class people are being vastly affected by today. While behind closed doors, BlackRock just told you that Bitcoin is definitely the asset you need to get. But over the past 2 years, they have tried to make it seem as if it's something that you shouldn't get into because it's so volatile, while they've been behind the scenes gobbling it up. Understand this, poor white people. Understand. The only solution to the Bitcoin was created to absorb the entire debt of the United States. All of it, the derivatives, the debt that you see on the debt clock in general. Okay, it was created in a way that it absorbs that. So understand this: the way that you stop inflation is by not using the US dollar. So if we don't tell black people how to properly use cryptocurrency and blockchain technology, if we don't allow for them to integrate it the right way, then we effectively stop them from being able to be economically free. You know, the collateral damage from that is, poor white people won't get to know that the solution to their dilemma today is actually crypto adoption. And so if all you're thinking about is trading, then the market psychology goes into the hands of the smart money, because on the ground level, you're treating crypto like it is a stock, and it is not. It's time for y'all to read the Bitcoin white paper so you can properly understand what you're supposed to be doing with your Bitcoin. But what I'm saying to y'all today is this: there is no solution to the economic crisis in front of us besides allowing for the American people to properly adopt and integrate blockchain technology and Bitcoin and cryptos and use it for the benefit of staving off inflation. When you talk about Bitcoin as a hedge against inflation, you're looking at it from the wrong standpoint or point of view, because if you're looking at it as a hedge, just like you look at gold, then you are saying that you already need to have a certain amount of wealth to even accumulate these things. And that is not the issue that we are having when it comes to dealing with inflation. It's not the fact that you need to have a certain amount of wealth in order to get into Bitcoin. It's the fact that you need to be utilizing Bitcoin and cryptocurrencies to purchase everyday goods as opposed to the US dollar in order to stop the increase in price valued in dollars. And so you telling me that right now there is an actual solution to this economic crunch that we're in, but they don't want you to know about it just because they don't want black people to be free. That is diabolical at the end of the day. Wake up, people.
Hey, people. Good morning. TikTok. Y'all should go take a look at this whole video. My friend here I don't know her yet, but she will be after this video. We'll be friends after this. They have been doing this to the poor people, and they have done it to the African American race. They want to be the hand that feeds us. And even Dick Gregory, if y'all haven't listened to Dick Gregory, he was a philosopher, and he talked a lot about equality and racism, things that actually exist instead of BS ideas. He said that they'll put the malt liquor on certain parts of town, like on the other side of the tracks. You won't see that in the certain parts of town where a lot of the rich people live, but they have manganese in this malt liquor and stuff like that you'll see, and it's cheaper. And he said manganese will make you your mama. These were his words. I could find the video. It'd take me hours to find it, but Dick Gregory said that, and they have been dumbing down and classes of people that they do not like, and they want all of us to be slaves to their system. And all of this, man, there's a reason why these greats are not with us to this day. Martin Luther King and some of these people that were spitting truth about civil and social issues. And now we've got a mess on our hands. All the white people, most of them. And a lot of the division has been caused from the news, from the government, and they know it. The other day, I want to share this with y'all. The other day, I was playing PS5 with my son, my 14-year-old son, and I looked down at my controller, and it was red. It had a red light around it. And I was like, that's weird. I guess my battery's low. We were playing the NBA or something. I looked over at his controller, and it wasn't green like it had a charge. It was blue. It was a different color. I've seen the red and blue before. I've seen it on top of a police car when they pulled me over. I've seen it in the Democrat and Republican race. I've seen it with electric and magnetic. I've seen it with the sun and moon. I've seen it on TikTok logo, the red and blue that, go like this. And then in the middle, they make purple, because purple is the color of unity. But they want some of us to be Democrats and some to be Republicans, because as Jesus said, the house divided will not stand. And the problem is the White House is dividing it, and those days are coming to an end pretty soon. We've got some astrological placements that are going to even out some things. Sit back and watch the next 2 years. Love y'all. Bye.
We'll get it.
If you want to read more stuff about this, I would recommend The Sum of Us. I think the whole title is What Costs Everyone and How We Can Succeed Together, or something like that. It's by Heather McGee. She'll put you up on game on how deep the rabbit hole actually goes. If you want to know why you don't have certain things, if you want to know why there are certain freedoms that you could have, or certain things in the society that we could all share, read that book. It'll shed a lot of light on why is very expensive for our society, and why we should all work towards being anti-racist.
Now, articism is a serious threat to the public's health. Articism is a system consisting of structures, policies, practices, and norms that assigns value and determines opportunity based on the way people look or the color of their skin. Now, the results in conditions that unfairly advantages some and disadvantage others through society, both interpersonal and structural, negatively affects the mental and physical health of millions of people, preventing them from attaining their highest level of health and consequently affecting the health of the nation. Now, a growing body of research shows that centuries of articism in this country has had a profound and negative impact on communities of color. The impact is pervasive and deeply embedded in our society, affecting where one lives, learns, worships, and plays, creating inequalities in access to a range of social and economic benefits such as housing, education, wealth, and employment. Now, these conditions, often referred to as social determinants of health, are key drivers of health inequalities within communities of color. Now, placing people of color at greater risk for poor health care outcomes. The life expectancy of non-Hispanic or Black Americans is 4 years lower than that of white Americans. Now, to build a healthier America for all, people must confront the systems and the policies that have resulted in the generational injustice that has given rise to racial and ethnic health inequalities. Now, healthcare is very expensive. The Affordable Care Act has helped to ensure healthcare coverage for millions of Americans. The uninsured rate among African Americans declined after the law was implemented. More than 20 million people who have gained coverage under the ACA. 2.8 million of them are African Americans. Yet this population is still more likely to be uninsured than palm color Americans. Now, as of 2018, the uninsured rate among African Americans was 2.9%, while it was just 5.4% among palm color people. Now, African Americans were more likely covered through employer-sponsored or private health insurance, but 55% of African Americans use private health insurance in 2018, while 41.2% were enrolled in Medicaid or some other type of public health insurance. While coverage expansions under the ACA have hastened the progress toward universal coverage, the continued high cost of many coverage options means that access to affordable healthcare is still a challenge for many Americans, particularly African Americans. Despite coverage gains, remaining healthcare challenges exist that have a disproportionate impact on African Americans. The lack of Medicaid expansion in key states, health disparities, and healthcare provider shortages make it incredibly hard to address America's healthcare needs in a comprehensive way. And while these challenges are factors that touch many Americans in various parts of the country, the gravity of them is uniquely seen in the South and among the African American population. Now, disparities still exist across health conditions when comparing African Americans and whites, including maternal mortality, infant mortality, heart disease, diabetes, cancer, and other health issues. Social factors, including economic disadvantage, inequalities in education, and lack of access to healthcare, impact a person's ability to lead a healthy and productive life. Now, for people in an American society, especially that experience racism, and we know the people who experience racism and inequality in their daily lives and throughout the lifespan, the impact of social factors on health are the most grave. Due to residential segregation, majority of African Americans and Hispanic areas are more likely to lack hospitals and other healthcare providers. Therefore, place matters. When healthcare providers are located within majority African and Hispanic neighborhoods, they tend to offer lower quality care. Often people of color tend to rely on community health centers, emergency rooms, or outpatient care and community-based providers due to the lack of available primary care and mental health providers in a given geographic area. Now, all these challenges for people of color just because they feel it is the only way that people are going to beat, or they are going to solve their color, race, whatever they are calling it. Now, after watching the video and listening to what people said in the speeches, what are your comments on this? As usual, share your thoughts in the comment section. From me, bye-bye, and thank you for watching.